So I welcome everyone. I'm Deborah Lupton from UNSW Sydney. I'm also a member of AusSage. Welcome to the Politics of COVID-19 in Australia. We have speaking today. First, I'm going to kick off with about 10 minutes of an overview, just of the key issues to sort of set the scene of the topic under discussion today. Then we have Blair Williams from Monash University, and we have Dr. Patrick Harris as well. So Dr. Blair Williams and Dr. Patrick Harris is also at UNSW Sydney, and Professor Chris Willis from the University of Canberra will finish up the talks, but then we will have about 20 minutes of Q&A time, discussion time. But before I get talking, I'd like to acknowledge that my university is on the lands of the Bedegal and Gadigal people of the Eora Nation, and these lands were never ceded, and these peoples are still fighting to be recognised for their millennia of custodianship over those lands. Always was, always will be their lands. And I have learned a lot actually in most of my research about Indigenous knowledges and how they contribute to everyone's health.
But there will be quite a big focus today on.
So, little person. So, rules of engagement. Now, can everyone please mute themselves for a start? Thank you. Rules of engagement. Now, the politics of COVID, as everyone here I'm sure knows, can get pretty fraught. Sort of high emotions, beliefs on all sides of the various debates around politics of COVID. So we will be discussing some, I guess, fairly fraught issues today. And I'd just like everyone here today to remember these rules of engagement. This is a discussion open to the public, and it is being recorded and it will be posted to YouTube. All questions or comments are to be posted in the chat and I will moderate them. And so just you can feel free to post comments and questions as we go, and then I will look at them at the end for the Q&A. And obviously I will not be reading out any that are not respectful or not temperate. So please keep all comments and any social media posts about this event respectful and temperate. No name calling, abuse or trolling in respect to the presenters or any other individual will be tolerated. And do not make any comments here or on social media that may be construed as defamatory, because in the litigious environment of the Australian media scape, people can get caught out quite badly there. So please, everyone, remember those rules. So I'm going to start off by, as I said, just giving a bit of an overview of the key issues around the politics of COVID in Australia. These are 3 books that I've either authored, co-authored, co-edited, or included a relevant chapter in. COVID-19 crisis had perspectives from various countries, including Australia. The Face Mask in COVID Times, as the title suggests, focuses on this very political object and looks at the politics behind why it is such a fraught, why face mask wearing is such a fraught practice in the current times around COVID politics. COVID Society's Theorising the Coronavirus Crisis looks at various different theoretical perspectives you could bring to bear to understand social impacts and effects of, I guess, how people are responding to the risks around COVID, and I guess engaging in quite, again, often quite highly emotive, in some cases violent and aggressive reactions to public health mitigations or mandates around COVID prevention. And this book, Risk, which is a 3rd edition of a book I actually wrote 25 years ago, and because I was asked to update it and revise it by my publishers, Routledge, about a year ago, I was able to include all the different chapters, references to this latest risk phenomenon, COVID-19. And I've also included a brand new chapter that looks at post-truth politics and misinformation and all the sort of debates and sort of strategies that are used, again, by people on different sides of the fence in relation not only to the COVID crisis, but
Can you
also
just wash your hands, Lovey, because I know that the sneeze wasn't anything properly,
to the climate emergency.
but just in case.
So I will be talking a little bit about some of the issues I discuss in these books. So just to begin with, this is the situation now here in Australia. I'm using deaths per million because, as we know, COVID cases aren't really reported very well, or even in surveillance systems, people aren't obliged to report them even if they do test themselves for COVID. So, but we can see from COVID deaths per million in Australia, the various waves that we've had since the emergence of the virus in very early 2020 and the 8 waves that we've had. We can also see from this graph what happened when mitigations were loosened, borders were opened, and the so-called let it rip policy began in late 2021, followed by the Omicron, the first variant of Omicron, the first strain of Omicron, which unfortunately the vaccines that we all had gone out and had the first 2 doses didn't deal very well with in preventing. So many deaths in response to that first Omicron wave. And it's interesting too to compare it with other Anglophone wealthy nations who have in the first 2 years had very different experiences from Australia because they didn't engage in such strong protections and mitigations as we did here in Australia, including, you know, our international border closures, and our quarantine system, which made a huge impact on preventing the egress of the virus into Australia for those first 2 years. We can see, and again, it's per million people, so it's per capita graph. We can see that the United Kingdom in particular has had a very bad time with deaths, particularly in the first 2 years, whereas we had very comparatively few deaths. And the United States, they're in the black, sort of in the middle there too, but again, in the first 3 years really has had very many deaths per million compared to Australia. So what we are seeing right now is, and this is actually a news story that came out just this morning, so I was able to include it today. We are seeing that there is a lot of complacency in the population. This particular story was by a vaccine expert in Australia being interviewed about low levels of people going out and getting their boosters, even though they're eligible to get them. It's interesting when I watched this report that the journalist who was interviewing him kept saying, well, why do you think people are so complacent? Why do you think people aren't going out and getting the boosters that they're eligible for? And he wasn't really able to answer that because he doesn't do that kind of social research. He's very much a sort of attitude to vaccination person. But he kept repeating that it was really important for everyone to go and get them, which was the right message for him. But as a media researcher and social researcher just of some societal impacts of COVID, what I would have said is basically there's very little information around. COVID has become invisible. We just don't hear about it anymore. And if we think back, for example, to the kinds of metrics we were getting 2.5 years ago, this is from January 2021, from the ACT Health Twitter account, and all the other states and territories health departments had regular, every day updates such as these. So it was very easy for us to find this information about how many cases, how many people in ICU, how many people were even ventilated, that gets that specific, how many people in hospital, how many boosters were being given, and so on. There was lots of information for the public to access. Even a year and a half ago, The Guardian Australia online had many very detailed updates about all sorts of information around vaccination, around cases, around hospital cases and so on. We do not get this information anymore. So it's no wonder that people are in the dark about what's going on. Media coverage, this is using the Factiva database of press coverage in Australian press outlets. You can just see from the very, very simple graph, the loss of interest, at least in headlines. It's just looking at headlines that have the words COVID or pandemic or coronavirus in the years 2020, 21 and 2022. You just see the massive loss of interest last year, for example, compared to the first 2 years. We have had news coverage such as this. This is published on the 1st of January 2022. Welcome to 2022, the year this pandemic ends, which of course a year and a half later has been shown to be not quite accurate. We have had the hybrid immunity thesis being promoted very strongly by important political figures such as our Chief Medical Officer, Paul Kelly. So this is just a few examples since November 2022, where in various media outlets, he has really pushed this notion of hybrid immunity and how we are very much protected, according to him, from hybrid immunity, either from vaccination or from infection or both. But what's interesting to me too is if you look at media reports where there has been the opportunity for readers to comment, such as this report that came out in the Sydney Morning Herald last month, alert not alarmed, Australians less concerned about COVID. So again, the same old story that Australians, are complacent or apathetic, even though there are rising cases, even though the COVID has not gone away. There's still lots of deaths and hospitalisations and cases. But when I looked at the comments, as you can see there on the right-hand side, there were hundreds of comments, and many of them were actually just everyday Australians saying, well, why aren't we aren't complacent, why aren't we getting more information?
Just you haven't.
In the dark.
Another one.
Everyone, please mute yourself. And many comments like this, amongst the hundreds of comments in response to that particular article. So just in terms of, from a social researcher perspective, some of the socioeconomic context that we're seeing right now, and there's just a few examples of some of the public health campaigns, for good or for worse, that have been disseminated by Australian health authorities, government agencies, health departments and so on, there on the right-hand side, the various different ones we've had over the past 2.5, in the first 2.5 years of the pandemic. We aren't seeing very many campaigns these days. So the political economic context, we've got the neoliberalist focus, the withdrawal of the state, the privilege of the economy, the emphasis on personal responsibility, and the marginalisation of the disadvantaged. We're seeing that in Australia, we're seeing that really across the world. In Australia, though, the social groups left behind are older Australians, especially those in aged care. I mean, the vaccination rate at the moment of boosters is just appalling amongst aged care residents. And of course, the death rates are appalling as well. They're not being protected adequately. Children have not been, it's still impossible to get vaccinations for children under 5. They are not being protected. They're not being protected in schools. People with long COVID, we did have the report, the inquiry into long COVID that was released not long ago, which was fantastic. Let's see if there's any government response to that. Culturally and linguistically diverse communities and Indigenous communities have been very hard hit by withdrawal of protections and mitigations and not adequate vaccination sort of promotion. Disabled and chronically ill and immunocompromised people have been left behind, and their needs have been rendered fairly invisible in recent times, including their right to access to spaces, to safe spaces where they can be part of society. We've seen the withdrawal of public health controls and over-reliance on pharmaceutical solutions such as vaccines and antivirals, which of course are very, very important, and I very much support those. Don't want to be, don't get me wrong, but of course we do need all the other so-called non-pharmaceutical solutions. We need clean air, we need mask wearing, particularly in healthcare settings and aged care settings and schools, for example, where COVID infection is just going rampant and not being prevented. We're seeing the abandonment of workplace health and safety protocols. We're seeing healthcare safety failures for patients and staff, and infrastructural failures, lack of clean air provision, and so on. So just my last slide, which is actually probably the most important one, what I call big COVID. And that is drawing on the, the idea of big tobacco or big oil. So basically the post-truth politics part of things. The actors that are involved, we can see right-wing or libertarian politicians, both current and former, involved in sort of promoting misinformation and conspiracy theories, extremist fringe media using social media sites to promote misinformation. We're seeing wealthy corporations and funding think tanks, lobby groups, and promoting contrarian views. Now this, there's ample evidence of this in other countries. There's been great investigative journalism that has actually identified the people who are acting here. We haven't really had the same level of investigative journalism here in Australia to really identify the links between these kinds of corporate funding and the sort of people with a lot of power and established expertise who might be wanting to push a certain agenda in terms of COVID public health. At least overseas, we can see senior academics at prestigious universities, for example, those involved with the Great Barrington Declaration and Brownstone Institute, being invited by political leaders to have a strong influence on health policy, the role of consultancies, which are a bit on the nose in Australia anyway, because of all the scandals around leaking and privacy breaches, but they have also had a major impact on government policy around the world. We've seen so-called patient voice consultancies and think tanks, often underpinned by commercial corporate interests of big pharma and private healthcare providers. Some of this has happened in Australia as well as in other wealthy countries. And what is really interesting to me too is, and I do discuss this in this chapter in my risk book, is we get the very marginalised, disaffected people who have been pushed out of society for one reason or other because they're underprivileged and they're unemployed. They're feeling a lot of great sense of grievance because they have been sort of marginalised in our unequal and unjust community and society. But being sort of those people being egged on by experts and, people with a lot of power and privilege, egged on to sort of protest against COVID mitigations and public health policies, and do freedom convoys and so on, making death threats to people, and even the domestic terrorism that we sadly saw in Queensland with the murder of the police officers. So I will leave it there. I'm now going to stop my screen sharing and allow Blair to share her screen.
Before I start, Deb, could you please mute everyone by clicking participants and then click mute all? Because I'm being driven crazy.
Yep, sorry. So it's on the mute audio settings.
You click participants.
Oh, participants, right.
And then click mute all.
Mute all. Ah, there it is. Okay, I was trying to do it on the mute button. There we go.
Oh, that just muted myself. Okay, awesome. And hopefully that'll mute everyone because my brain is slightly going crazy. Okay, cool. So let's get mine started and I'll try and whiz through this one. Timed myself, so let's see how we go. All right, so COVID hegemony. If you follow me on Twitter, you probably have heard me speak about this, but let's dive into it a bit more. So for the first 18 months of the pandemic, Australia was the envy of the world, but we've since let it rip, and now we face widespread infection, mass disability, and a high excess mortality rate. So how did we get here? Though letting COVID rip occurred on Morrison's watch, with the help of Dominic Perrottet, of course, the Albanese government continued this approach, which resulted in more COVID deaths in just their first 6 months than occurred under the Morrison government. Somehow, Albanese finished 2022 with its highest approval rating, but this approval contrasts, as you can see here in the graph, with public opinion in 2020 and 2021, when most of those surveyed expressed strong support for state-mandated protections and were not comfortable with easing restrictions if it meant an increase in deaths. What then explains this drastic change in our attitudes? A bit of theory first, because it's sociology and political science after all. So to explain this shift in attitudes, I now turn to Marxist philosopher Antonio Gramsci, particularly his theorization of cultural hegemony. Cultural hegemony refers to the maintained domination of those in power over others through the control and manipulation of cultural institutions, beliefs, values, and practices. Basically, the goal is to impose their worldview so that those in power have control of the political, economic, and social status quo, and that is perceived as natural, inevitable, and advantageous to all. Gramsci theorized that the exercise of hegemony depends on a balanced combination of force and consensus, so that it appears to be based on the consent of the majority. So that is, the ruling class maintain dominance by gaining the consent and even approval of the masses, persuading them to accept these dominant and moral and political values. However, when force is actually necessary, it must be concealed so that it doesn't break this illusion of consent needed to successfully uphold hegemony. So power then basically is enacted through consensus, compliance, and self-regulation rather than through enforced governance. What's this got to do with COVID? Well, I draw on Gramsci's theory and propose the idea of COVID hegemony to explain this transformation of our pandemic outlook. What is COVID hegemony? Well, it's the normalization of widespread infection achieved by those with power through coercive persuasion to gain our consent and even our approval. The goal is to return to normal, to live with COVID, even if it's still unsafe. Our government's mainstream media and certain health commentators have persuaded Australians to accept increasing morbidity, mortality, and the erosion of our public health systems using 4 key strategies, which I will now look at in a bit more detail. So the first one is the adoption and promotion of myths about the virus that downplay its severity. In late 2021 and 2022, there was a real push by the media, as Deb has looked at, certain experts and politicians to return to normal and basically gain our consent. And to gain that, they spouted numerous myths that you can see on this slide. These myths are unsupported by scientific evidence, downplay the severity of the virus, and create this false view that the health consequences of COVID are minor or even trivial. As such, we perceive the pandemic as less risky and any protective measures as an overreaction or anxiety. The second strategy is the suppression of COVID-related data and other information. As part of the business as usual model adopted by the Albanese government, federal and state governments now actively suppress COVID data through reducing daily updates to weekly totals, significantly reducing access to PCR tests, and encouraging the use of rats despite their unaffordability and increasingly inaccurate results. This limited access, in addition to lifting a previous requirement to report a positive rat result, and in recent days with Victoria declaring they won't even count a positive rat in their tally, it means that the reported case numbers are basically unreliable and hide the true number of infections to present this rosier picture of what we're going through. And much of the research and modelling that the federal government has commissioned to support their response to COVID has not even been publicly released. The public have therefore been persuaded to lower their personal risk perception and their expectation of the role that the state should take in protecting citizens from harm without access to all the facts, while pathologizing those who continue to do their best to avoid COVID. The third strategy is the adaptation of pre-existing beliefs or public opinion. So Gramsci foresaw the use of public opinion by the state to coerce the public into acceptance of an unpopular action by creating the adequate public opinion or common sense. However, rather than imposing preconceived ideologies from above, this requires a complex negotiated process of working with existing beliefs, prejudices, and predilections. So to encourage the consent of the people, political leaders, the mainstream media, and certain health experts have used the idea of, for example, pandemic fatigue, the exhaustion felt after months of sustained and unresolved adversity and disruptions, resulting in that lowered risk perception. They've used that to remove mandated protections. And this has become public opinion or common sense, and has been used to justify the return to normal and government's laissez-faire approaches. We're also now seeing back to work propaganda that blames working from home for the increase of vascular issues, diabetes, and increased infections, instead of, the novel vascular disease that's running rampant. And lastly, the fourth strategy is the prioritization of a hyper-individualistic discourse over a collective approach that champions shared responsibility. This is evidenced through the mantra of personal responsibility, which is underpinned by neoliberal ideals such as rugged individualism, small government, and self-resilience. Adopting such a hyper-individualistic response ultimately shifts blame from the state to the citizen. So we've now consented to the idea of living with COVID. Widespread transmission has come to be seen as inevitable and a necessary sacrifice to return to a pre-2020 way of life. And most Australians now seem to prefer to return to business as usual and seldom acknowledge the great burden that unmitigated transmission and especially the impact of long COVID will have on society, the economy, and our individual and collective health and well-being. Yet living with COVID means dying with COVID and is only beneficial for those who stand to gain the most from a return to the pre-pandemic status quo. That is, the employers and business leaders who depend on the uninterrupted circulation of capital and commodities. It's also politically beneficial as it transfers responsibility for reducing the spread of the virus and caring for those affected from the state to the individual, thereby precipitating what Chris Willis has called the biggest victory for neoliberal public health policy in memory. So we obviously need a reset of COVID policy, in line with what Professor Brendan Crabb calls an anti-transmission strategy. So the strategies I've identified could easily be adapted to change the current pandemic narrative and bring people on board. So first, rather than adopt myths, the government should be countering the myths minimizing COVID that have taken hold throughout the pandemic. And as we've seen, a lack of transparency regarding increasing rates of health problems and long COVID currently enables anti-vaxxers to take advantage of this information deficit to promote dis or misinformation. Second, rather than suppress COVID data, the government needs to be transparent. And a first step would be to publish the data and modelling that the government has collected throughout the pandemic. Another would be to make PCR tests accessible and safe, and encourage more widespread testing so we can actually know the number of infections. Third, the current framing of the pandemic must be changed from one of complacency to a renewed focus on reducing transmission and harm. And so integral to this one would be, a powerful public health campaign informing the public of airborne transmission, encourage use of N95 masks, and emphasize the importance of clean air in public spaces and businesses, preferably legalizing it so we can sue them if they don't have clean air. Lastly, an empathetic and comprehensive approach to the pandemic is needed. Instead of promoting this you do you attitude that pushes vulnerable people out of all areas of public life, governments should be ensuring the safety and the social rights of those most at risk. So the goal of COVID hegemony is to not only return to that pre-pandemic status quo and cosplay like it's 2019, but is actually part of the neoliberal project to lower our expectations of government, so that blame for the mismanagement of the pandemic could be transferred from the state to the individual without much resistance. We must push back against this COVID hegemony, which means instead of ignoring the virus, we need to adapt to a new reality, one that focuses on reducing transmission and embraces living safely with COVID for all Australians. Thanks.
Thanks, Blair. Fantastic. And yes, as people have noted, Blair wrote a great piece for the Canberra Times explaining the concept of COVID hegemony. It's really, it's got a lot of had a lot of impact actually. Now, Patrick, I saw you did manage to get on. Hello. Would you like to see if you can, do you have slides, Patrick?
I do. Hang on, I've just seen. Can you see me? All right.
Yeah, I can see you. Hi.
Hi. Good. Yeah, I do. I'll just try and share my slides with you. So.
Great. Thank you. And I've noticed lots of comments and chat in the chat. So keep it up, everyone. Great to see everyone sort of commenting and engaging with each other as well.
So I don't tend to use Zoom very often. What am I looking at here? So I've got
Look for the green button at the bottom,
yeah,
share screen.
What it wants me to do is not window. Right, hang on a second. Apologies. It's not finding my presentation, which is a bit weird. Yeah, I'm just gonna find. Sorry, I'm on. Not really. I can't find my presentation. It's
Is
not
your
showing
presentation open in a separate screen?
Yeah, that's probably the problem. I'll just, no, it's open on this screen now. So sorry about this, guys.
No
It's just not coming up. There it is. Got it. Okay.
Everyone's just chatting amongst
Okay,
themselves, so that's fine. Here we go. I can see it.
Okay, you can see it. Right, good.
Just need to make it full screen, Patrick.
Yeah, just doing that. Can you see that? So
Yeah, that's great.
Great. I'm talking to you from the land of the Gabrogal people of the Great Darug Nation, and pay my respects to elders past, present, and emerging. So I'm going to talk a bit about what I know of politics and COVID from my own position. I'm not an epidemiologist. I'm not an infectious disease specialist, but I am interested in policy and institutions around policy. I'm probably not as deeply engaged with this as you are. But I'll give my 2 cents anyway. What I'm going to do is I'll talk a little bit about my interests, a bit about my research on COVID and where it's come from, which is quite different from your research, although it has overlaps. A history lesson, and then a quick reflections about politics, which actually overlaps a lot with the previous presentation. So I'm not on Twitter anymore. I was. I left it because I can't stand Elon Musk. And I don't believe with the approach he's taking to it. So I left, and I've got to be honest, my life is a lot better without it. So just as long as you acknowledge that, I haven't been on Twitter for about a year, so I've got no idea the debates that have been happening on Twitter. My work's what we call in public health. I'm a public health specialist, but my work is really around what we call upstream, so upstream determinants of health. I won't go into detail about this, but what I'm really interested in is these top 2 layers here, which is about institutions and social and economic policies. And a lot of what you're talking about are around risk factors and constitutional factors and these kind of pathways, individual and population health. I think sometimes you are talking about all this as well, but I think sometimes we forget to zero in on some of these things at the top layer, and that's a challenge for both public health research. I'm an academic, but also practice. What are we really trying to influence? And I'll come back to that later on. So my first foray into COVID, I actually did post this on Twitter. I remember when it first happened, I posted that I was caught into the vortex of COVID and I had to start doing some work on it. So this was around about 2019. My colleagues and I from around the world actually got together and did a commentary piece around my main areas in around cities and infrastructure and city development and city policy. So, and how they interact with health and well-being and equity. So we got together and we sort of applied an equity lens to urban policy measures for COVID. And what was quite clear to us at that early stage, despite really not being systematic, was how the virus was really making clear a global, interestingly, we're talking about hegemonies, but the global, globalization and capitalism and the way that the world was working was really fundamental to the spread of the virus, and still is in terms of the responses, I'd say too. So what we also found was there was a clear urban angle on the work, and we compared 4 cities for that early response. Then we did a more systematic review. I did, and lots of colleagues of mine did a systematic review or a scoping review around respiratory pandemics more broadly and urban planning and design. And we went back over the century and looked at the literature across all the thinking about urban planning and cities. And there actually was a lot. I was always surprised actually when we were doing this work that it seems we forget very quickly after a pandemic about the history, the lessons from history, and COVID is really no different, and I'll come back to history right at the end of the presentation. What we found with that work, and this is a lot of detail about really taking an intersectoral approach to thinking about COVID from a city's perspective. I'm not that interested you're probably not going to be that interested in the topic so much as really clustering of complexity when you're thinking about what the response both to preventing it, but also then mitigating and adapting to COVID as well. And what I was just talking about in terms of the middle of this is the scale. So you really have to think globally as well as locally in relation to this. So someone this morning was talking about a new variant of the virus in Japan in a meeting I had this morning. I mean, that's another example of how scale does matter in terms of COVID, and we need to be looking out for new variants, etc. But across all these different dynamics, you've got the built environment, clearly that's around cities. Governance, deliberation, and ethics is really important too. Modeling was kind of really interesting because there were these bits of the literature that was sort of saying, oh, if we model it, you will have to do something. And of course, we know that's not true. Non-pharmaceutical interventions were really important and remain today. But also things like socioeconomic causes. I think we often forget the socioeconomic and equity dimension to COVID, both in terms of preventing and also the response. And then things like setting up systems and system responses and then future-proofing urban planning and design, which I'll come back into in just a second. The next piece of work, and I've put all the papers in here, was around first housing, and I did that with some colleagues at Sydney University, and then financial precarity, which I did with some colleagues in Canada. But starting with the housing work, what we found was we looked at rental clusterings through at the beginning of the pandemic, and it was quite clear to us that there were some major risks around what you did as a job, but also your socioeconomic status. And what we showed was that that COVID really creates a challenge in cities and societies around precarity, right? So rising unaffordability of housing, keeping people renting for longer, and increasingly poorer conditions. And what we showed is they've not been disrupted at all by the initial response to COVID. In fact, they were exacerbated by the pandemic. There was an increase in homelessness, there was moving around populations, etc. And what we showed was the link between public health and housing required a rapid response, but it also, as I was saying, created challenges. And then what we really concluded was that instead of in addition to, but really at the core of thinking about our response to COVID is actually thinking about a societal response to COVID. And in this instance, we know that greater tenure protection and increased availability of affordable rental housing will alleviate many of the risks around, where you live, then where you go back home, and how the virus is spread. But what's happened since that, of course, is that that's got worse. Those things of tenure protections and increased availability of affordable housing, let alone rental housing, is much, much worse. So there are great risks that need to be focused on from the pandemic, and really haven't at this stage, as far as I can see, been addressed properly in particularly state policy, but also federal policy. And then we did some interesting work around really financial strain and precarity, and we compared, this is my colleagues in Canada, we compared Australia and Canada. And lo and behold, Australia came out much worse than the federated system in Australia came out much worse than Canada in terms of setting out financial supports. Not forgetting that Canada had a socially oriented or a centrist government, whereas we were under the Morrison government, which was really focused about not all about financial support and inequity at all. But what we did really interestingly in that work was we came up with a public health approach to thinking about financial well-being. And I won't again go into detail here. I just want for you to think through what's the dimensions of dealing with financial precarity from a public health perspective are, because they're extremely complicated, but they also overlap with what you would do to deal with COVID in general. And that's to think in the middle about all levels of government, think about different organizations and political cultures, the socioeconomic and political context, also thinking about cultural circumstances for people, and someone was talking about that before in terms of called responses, and also life circumstances, going back to the determinants of health and the life course. And then all these things around the outside are all really policy measures to support financial well-being in the face of something like COVID, and that both protects from COVID, but also deals with societal challenges that lead to COVID as well. So. And I think none of these things are really seriously being focused on in terms of policy, either in Australia or Canada. But we did come up with this framework as something that public health people should consider more broadly about our response to to COVID. Quickly, in terms of history, when I first came to this, because I was thinking about the history of COVID and wanted to do that literature review I was talking about, I came across a really great article by someone in the conversation who I don't know, a guy called Jeff Kildare, and from UNSWC. I've got no idea about who this guy is, but he wrote a really great piece very early on. See, the date is May 22, 2020, and that's called, you can get this on in the conversation, called Lockdowns, Second Waves and Burnouts, Spanish Flu's Clues About How Coronavirus Might Play Out in Australia. And again, learning from history, this is quite amazing where we're up to now. So the article talks about various waves of responses to COVID, and I've started here with Spanish flu subsides. So not COVID, Spanish flu in this case. Nevertheless, New South Wales' prompt and thorough application of restrictions initially proved successful, but by the end of February, the New South Wales lifted most restrictions. Even so, the state government did not escape a political attack. The Labour opposition accused it of overreacting and imposing unnecessary economic and social burdens on people. It was particularly critical that the order requiring mask wearing was not limited to confined spaces such as public transport. And then COVID returns. And then in March, COVID returned, and that led to the Catholic press to declare the ministry fiddled for popularity while the country was threatened with this terrible pestilence. Moving forward again, then the government over a bit of time goes for what they called at the time burnout. So after 2 unsuccessful attempts to defeat the epidemic, at great social and economic cost, the government decided to let it take its course, with the Sydney Morning Herald declaring there is a stage at which governmental responsibility for public health ends. And going down to the bottom of this page, this is what's really interesting from a politics perspective, is that the New South Wales government decision not to restore restrictions saw the epidemic burn out, but at a terrible cost to lives. That decision did not cause a ripple of objection. And the evidence for that is that the New South Wales state elections in March 1920, Spanish flu was not even a campaign issue. Now, I've looked back actually, and it was interesting that the Liberal government that was in at the time was voted out at that election, but obviously it was not part of a campaign or either of the parties. So my point is, when you think with a political lens, one of the things that needs to be created is exactly what this framework's doing. So thinking with an institutional lens to the challenge of dealing with COVID. And I found this from an interesting paper, a case study from British Columbia, which is in a book. So if you Google it, you can get it. What the challenge here is on the institutional side, and this is a bit like hegemonies, but it sort of moves on to the sort of latest political science around institutionalism, is that institutional norms and regulatory arrangements, etc., interact with politics, they interact with leadership, political agendas. And on that, the right-hand side of that, you've got organizations, so thinking about authority, legislative arrangements, whether we've got capacity to do anything about it in government. And then the middle of that is governance. But the most important thing I wanted people to think through are these things. So really, policy and policy responses are written and react to the broader societal context. So at some point, this idea of a notion of let it rip, we're tired of it, does play out. And that's because of the societal context and the fact we have been through 3 years of pandemic responses, right? I'm not saying that's right or that's wrong. I'm just saying that's fact. There's a societal context that is swirling around in and around that response to we're over COVID, right? But really what you're part of is a movement that's trying to galvanize pro-interventionist approach to COVID, and that's great. But what the challenge with that is that, I'm supposed to have another red mark here, is that leaders and decision makers essentially respond to that context. I think what's not happening at the moment is that they're not responding to citizen communities' demands in terms of the evidence that's presented. And at some point they have to. So what the previous presentation was talking about in terms of some of the strategies, I think are fantastic, but it's about setting yourself up to understand that this is the reality of politics, right? This is the reality of how policy is made. And it's about responding to issues in the community, but also driving issues in the community as well. And I think that some of the narrative you've got around being cautious and being worried about the intent of government is probably true, but at some point we have to shift the narrative more broadly so that leaders and decision makers are held to account for what it is that you want to achieve. And this is my last slide. I'm not sure what the end game is here from the presentations you've put forward. I'd like to think we're working towards an end game in terms of COVID, but is there really ever an end game? I mean, are we in that sort of downward spiral in terms of moving towards something else when COVID becomes yet another disease in society? And are we, or is the goal about some kind of societal change around equity and injustice and thinking about how diseases play out in society? I'm not clear where that fits. And of course, once you've got your goals sorted, these things are much easier in terms of affecting change. So that's my 2 cents. I'll stop sharing now.
Thanks, Patrick. Yeah, you packed a lot into that presentation. So thanks very much. I'm sure people, including myself, learned a lot from that. Now we are running over time because we had a few technical issues and things, but we've got plenty of time for Chris to speak and hopefully a little bit of time at the end for any burning questions people have. So Chris, take it away. I know you don't have a PowerPoint, so let's hear your dulcet tones. Thanks very much.
Thanks very much for the invitation, Deborah, and fantastic contribution from you, from Blair, and from Patrick. Love hearing people raise historical perspectives. Blair, thanks for some Gramsci. We always can do with our Gramsci greens in an afternoon webinar. Love it. And good work to everyone here. I suspect this is a self-selecting audience. You're probably all highly informed about COVID, and some of you are doing the hard yards on social media, trying to get better outcomes. So keep going. I'll be quick, but I kind of want to pick up from the end point of Patrick, which is to me a bit of a counsel of despair. I think, as academics, we get good at understanding things in ever finer detail, ever more granular understandings of problems. But the question is, what do you do with that information? How do you apply it? How do you get a better result? So, Patrick's totally correct about the societal perspective, but let's just think how politics actually works from a politician's standpoint briefly. The fact is, as Blair's so capably described in public and in the academy, that the anti-public health lobby dominates the channel of communications across the board. Print, broadcast, cable news, online news, social media. The drumbeat of anti-public health messaging is steady, and better informed people fight back as best we can. I think if we have a fault, we expect that good data and rational analysis will defeat wrong information and bad actor information. And I think that's what we're living through now, shows that to absolutely not be the case. We're herd animals. What we hear most is what we tend to believe, and we're not out there in as great a volume as the bad actors, unfortunately. The second point is that media stories are the currency of politics, and politicians are significantly driven by that key single thing. What is the media saying and doing about what's happening? So there's a long run tendency for politicians, even good ones, to succumb to dominant media narratives. Labor in opposition went against that significantly. As they were often in opposition, there was a political dividend for them in doing that. In government, that equation changes, and that tendency to kind of conform to the dominant narrative has very much been in evidence since May 2022, when the Albanese government was elected, to the immense disappointment of many who are shocked by what's happened in federal public health policy since the election. We expected it to get much better. It got just as bad, and over time worse. The government took its official public health policy advice from a notoriously neoliberal Chief Medical Officer, Paul Kelly, pretty much totally. I mean, who can forget the Prime Minister uttering the words personal responsibility in a press conference early on? Truly shocking. And Paul Kelly's let's call an end to COVID exceptionalism. What a low point in Australian public policy life. Terrible. And finally, the dismantling of reporting has been astonishing and appalling. It's left us really with only the death rate, COVID death rate, as a really reliable indicator of what's going on. Deaths are currently running at about 200 people a week. Third leading cause of death in Australia. That's really astonishing. I think the lack of spectacle around these deaths is a very big factor in why they're happening without a consequence politically. Have a bus crash and 11 people die, you get leading news coverage for days. Have 200 COVID deaths in a week, nothing, because they're isolated deaths distributed across people's homes and hospital wards where there aren't TV cameras. So the optics are very much working against improving public health policy in this area. So what have we got happening here? I mean, it's if you're a systems thinker, this looks like a classic systems trap, the drift to low performance. And, you know, as people like Daniela Meadows say, you know, what's going on here? Well, there's a feedback loop of eroding goals that becomes self-reinforcing. You know, it's got worse and worse. You all are familiar with the graph of cumulative deaths. They've just grown astonishingly since December 2021. And the proportion of deaths that have happened under a federal Labor government now is just, you know, catastrophically high and a serious embarrassment to the government, or it should be. So this is very disturbing. As an historian, of course, I look back to Labor's extraordinary achievement in the AIDS epidemic in the 1980s. And, you know, it's been a complete mystery to me that when we have such a recent example of a really amazingly difficult problem in HIV/AIDS being so capably handled by a federal Labor government that did a thing much harder than getting people to wear masks or get vaccinations. It actually got men having sex to put condoms on before doing so, in a very major behavioural shift in that community, with astonishingly fantastic results, saving so many lives. It's been a complete puzzle to me why Labor was able to do it then, but hasn't been able to do it now, or hasn't wanted to. And I must say, I benefited from a long phone call from Bill Botel, who gave me a little extra historical detail on that period, which I think may surprise some of you. It certainly surprised me. I was aware that the gay community's activism over AIDS deaths was very important in governments moving variously around the world on doing better in terms of public health policy responses. But what I didn't know was that Health Minister Leeuw had to basically stare down Australia's medical establishment, which I had not understood the depths of their neoliberalism, their laissez-faire default. Leeuw Blewett had to basically take on the health establishment to get that really strong HIV policy response up in the government. He was a personal champion of it. Bill, of course, himself was heavily involved, centrally involved. But I looked to the current health minister, Butler, who's a perfectly reasonable person, a nice guy, but just doesn't seem to have had the strength, even when he's been well briefed on the real situation, to move on his departmental head faster to some other position in the public service. I'm not saying he should have been sacked per se, but Brendan Murphy certainly should have been moved on as Health Department Secretary sooner rather than later. And Minister Butler's refusal to move Chief Medical Officer Paul Kelly has been catastrophic in terms of deaths in Australia. Again, shows a weakness on his part that's been absolutely lethal. So how do you get around this? How do you deal with this shift to low performance, this drift to low performance? Well, systems theorists will tell you what you need to do is establish an absolute standard, not a relative standard. That standard has to be a high standard, and you have to try and create a drift to high performance away from this eroding drift to low performance. How can that be made to be done? Well, I think one thing is we've got to find in the federal government, in state governments, somewhere in those cabinets, champions who will not only understand but take forward strongly the case for more intelligent public health action on COVID-19, because I think the Leeuw Blewett example shows that it's got to have a champion. Absent a Blewett being in that Hawke cabinet, I'm not sure there would have been another person to take up the cudgels. So I think the role of individual agency at cabinet level and state and federal governments is going to be really critical here. I think establishing an absolute standard for, and probably built around the COVID deaths metric, in a way that has a sufficient degree of dramatic cut through, and I'm talking spectacle here, folks, something that's newsworthy, something that people will pay attention to, and therefore something that can potentially move politicians is going to be really important. And finally, I'd just like to say that, you know, we're talking about COVID today, but we all know that in periods of very fast climate change, as we're experiencing now, pandemics become more often, they're more extreme, and to the extent that we have not got to grips with the COVID-19 pandemic yet, just weakens our likely response for the next pandemic, which is going to be sooner rather than later. I think a key symbol for me is the Albanese government's promise made in opposition to establish a national network of quarantine facilities around Australia, about which we've heard not another word, is very symbolic of the trouble we're in on this. So I would encourage everyone here to think harder and smarter about how we take our now very good understanding of all the problems with public health policy at this moment and translate it into action to get much better outcomes fast. Thanks.
Call to arms, Chris, and I noticed that people in the chat have been reading the chat as you've been writing into the chat, everyone. So the presenters have been taking good notice of what you've been saying, and what I'm hearing from you is a lot of frustration, a lot of anger, a lot of feeling marginalised, a lot of feelings of human rights are being overridden, and a lot of pessimism about public health authorities and government. And I think obviously everyone here wants things to change, the presenters and the participants here. The fact that we've now got this video of this presentation, I think, it'll be something that we can all use for, once I record it and finish recording it and upload it to YouTube. I mean, we now have this fairly short and sharp presentation. It's just an hour long for the four of us, where it'll be something that I really advocate people sharing, because it'll spread the word. It'll, I guess, raise consciousness, to use an old feminist term, I guess Marxist term as well. Those of us who've been knocking around public health for a while, like I have, we do remember the big fights over challenging big tobacco. I mean, it took time, it took a huge amount of funding. HIV/AIDS took a huge amount of community organisation and protesting. I mean, there was lack of action for many years by governments to deal with HIV/AIDS prevention and treatment. And there was massive community protest to actually get it on the agenda of governments and medical researchers. And we are not, we are seeing the protests on the part of the anti-public health people, which are a small minority. We aren't seeing that level of protest on the part of pro-public health people yet. So I guess we only have time, I guess, for just I guess that's my last comment. If we could just go around and yeah, we don't really have a lot of time for questions, unfortunately, but I have been reading the comments and have been seeing some of the questions. So I think I'd just like to finish really with everyone reading all the comments and seeing what everyone else has said. And I know that it's been a lot of really great engagement in the chat. And I'd just like to finish with Blair and then Patrick and then Chris. Just I don't know if you've managed to read much of the chat, but maybe if you can just respond quickly to what you have been reading in the chat, I think that would be the best way to finish. So Blair, can I invite you just to make a quick kind of comment on what you've been reading in the chat, please?
Yeah, I'm reading a lot. I'm still trying to catch up. Oh my God, it's 2060 messages. Yes. I think a lot of people are just really angry and feel lost over this, because there is no leadership from politicians, from media, from anything. It's a handful of academics and activists and people who care, but it's, I guess, all very splintered. So how do we change this when we're fighting against all the powers that be in many different ways, business, like government, media, all that kind of stuff. But at the same time, it's like, how is this how is this possible to live a future with rampant COVID and a climate crisis? Like, it doesn't compute. So it's not, viable really. So do we just have to wait until it gets even worse? I mean, that's a kind of the feeling I think many people are wondering, as well as myself, because, I try and think about, like, why is the government doing this? Why is the media doing this? Why is business doing this? Because if they're cold-blooded capitalists, like I might think they are, it doesn't make any sense for a capitalist. It makes sense, I guess, perhaps for a neoliberal, but even then, the economy is the health of the workers, it's the health of the people. So what does that mean when everyone is eventually disabled by long COVID? And then what does that mean, obviously, for healthcare and for people with disabilities already, and all those tensions that we're currently seeing. And I guess the last thing I want to say is I'm just worried about the rising fascism we're seeing. Like, this is eugenics, this is fascism, health fascism, but we're seeing this in conjunction with climate denialism, with mass transphobia, with all these other areas of fascism, and that is keeping me up at night and is scary to see. As a young person, is this my future? It's just worrying. So I don't know if that's a bit of a depressing statement. Chris, do you have anything wiser to say?
Yeah, look, I let other people do despair, because the minute we give into it,
I know.
the bad guys win. I think we have to kind of stop puzzling over the problems. We've got a good understanding of what's going on now. I think the insights Bill Botel has provided about how the Hawke government got that magnificent and highly effective HIV policy up need to be heeded. And I think it's going to take identifying the Neil Blewitts of the federal and state governments, the Neil Blewett of the ACTU, is it Sally McManus? She's got tinnitus from a COVID infection. We've got to identify the champions. We've got to get them together, and we've got to create somehow a self-reinforcing group that, seeded throughout the key institutions of our society, can run a strong pro-public health program agenda, not just for COVID, but in which COVID is a part, because it's COVID today. It could be a completely another thing next month, and we need to kind of get it. We need to focus it on COVID now, but we need to have this as part of a bigger picture in a climate change context of future fast pandemics, and being not just unprepared now, but behind the eight ball probably from where we were before COVID, because of the incredible politicization of it.
Thanks, Chris. And I'll just let Patrick, if he'd like to just say the last few words in response to comments you've been reading on the chat. Patrick, please.
Yeah, my first one is, people seem to like Twitter, so I may be an old Luddite and not be on the right bandwagon there in terms of my information. I find Twitter exhausting, so I had to give it up. I think one of the things we forget with a lot of the responses and the need to move on different issues and policy is, there's a couple of things. One is timing. Timing is everything, and I think with the pandemic, there's phases of a pandemic that happen, and historically they're documented. I wonder if we're in some kind of interesting phase that's after the peak, and some of the data you shows that, and yet we've still got this policy context which is challenged by shifting attention to the risks again when it fears the public outcry around that. But I think time does tell, and I think this goes to my second point. I think when you think about timing of when the window of opportunity is to make an influence in policy, you're not quite sure when that's going to happen, but your advocacy in this space, if you build yourself a decent coalition and get yourself prepared for that time, that's the point when you can start hitting and change will happen. Otherwise, you often can be hitting yourself against a brick wall. Chris, I take your point about when you show institutional frameworks, it's like, oh, what are we going to do? But what they do show you is the dynamics that you need to put into place to when something does open up and you can affect change. And I think that the idea about champions there is part of that. So it's interesting. I think I'm actually looking at you a bit of a sort of sociological experiment. It's quite interesting. I think you're a really interesting group of people who've got really interesting messages and evidence to bear on something. The timing doesn't seem to me to be in your favor, but at some point it might. And I think there's strategic things to be done in the ways you've outlined those, to be ready for when the timing does open up. And one last thing is, I do think there, despite this sort of, I don't know whether it's truth or not, there is a public discourse about being exhausted. about responses, and I think that has really affected people's mental well-being. You know, things like climate change are also other risks that affect people's mental well-being. I think you really have to grapple with that, and I don't think, and the evidence doesn't speak for itself, and we know that evidence in the public health sense, we're obsessed by evidence, but it just doesn't speak to people in the same way as we think it should. So I don't know what the answer, apart from, again, is to keep working, keep your energy up, keep thinking about what the responses are, and when the window opens up, you know, be ready for it. But you know, you can't work against current public opinion, and I do wonder, this lack of media discourse is part of that, because of course lack of media means lack of real interest in the issue, both politically and from the public. My sense is, from talking to people in the street, they are exhausted, and you need to be prepared to engage with that. And maybe that's part of the political campaign, is how do we make the reality of what's happening in terms of the data you're presenting really speak to people.
Very, very quickly, Patrick, that is absolutely the centerpiece of public health campaigning around issues like this. You know, governments shape behaviours, shape attitudes all the time. You know, the number one plank is how to energise people positively around effective action. And it's in
Sure,
that exhaustion, especially promoted by the media, is really become pervasive. But
I'm not saying it's right or wrong. I'm just saying it's fact, right? That's the thing you have to get across, right? That's the challenge. And the other thing is, sometimes, and this is why I presented some of that other work we've done around the intersectoral determinants of health stuff. Sometimes public health forgets its place in the pantheon of issues that are going on in society. I wonder if there is something around this which is tacking on to other things that are really happening, like economic inequality, poor housing, things like climate change. Those kind of things are also twin campaigns for this, that, as you quite rightly said, get caught up in this concern with the current government about not being too worried about acknowledging risk in society, because they're terrified about the response of communities when that risk becomes too out there, right? But this is real. The risks aren't going away, and I think at some point we have to put our public health bandwagon onto a broader societal approach to dealing with risk in society, right? It's not, the public health messaging has its point at certain points in time, and this might not be that point in time, is what I'm saying, but at some point it will be, right? Does that make sense? I was blabbering a bit, but hopefully it sort of made a bit of sense.
Thanks,
my response
Patrick.
would be, don't wait, do it now. Do it often, do it all the time, and turn Australia into a strong public health policy society. But
well, you know, there's
sharing territory here rather than disagreeing.
There's been lots of thoughts about that shared on the chat, and as well as people have been making connections to various advocacy groups, which is fantastic, and sharing that information with each other, which is fantastic as well. So, but we will need to draw things to a close now. Thanks everyone for being such an engaged and interested audience. Thank you to our wonderful presenters. I will go away and sort out uploading the recording to YouTube. I know there's some people have already asked me for a link to it because they couldn't make this talk today. So share that once, keep an eye on my Twitter feed. That's how I'll publicise it. I'll also publicise it in the COVID Safe Facebook groups I'm part of as well, which I know some of you are also part of. Thanks again, everyone, and see you around the socials, I guess, mostly, or online somewhere. Thanks again. Bye for now.